Hello there guys, welcome back or welcome if you're joining us for the first time. In today's video we'll be looking at drug interaction. Okay, so what is an interaction? Well, an interaction occurs when a patient baseline pharmacological response is altered by an external presence. So it could be drug herb, or drug food. Basically, this interaction alters the pharmaceutical, pharmacokinetic, or pharmacodynamic properties of the primary therapeutic agent. And the more drug a patient is on, the higher the risk of a drug-drug interaction happening. So a patient who's taking less than 5 drugs has a less risk of having a drug-drug interaction than a patient taking more than 10 drugs. Now, there are three types of interactions you could see. You could see a synergistic reaction, an antagonistic reaction, or an idiosyncratic interaction. Let's start with synergism, whereby two drugs come together to give an effect greater than their individual effects. And it can be by summation or by potentiation. In summation, both drugs combine to give the sum of their individual effects. A good example is ibuprofen and paracetamol, or sucralose and aspirin. Let's say one of them will give an effect of 2, the other gives an effect of 3. Together they give an effect of 5. Basic maths. Next up is synergism via potentiation, where you are enhancing the action of one drug by another drug which is supposed to be inactive. So you're having 2 plus 0 giving you 20. Now, the mechanism by which this works is by usually inhibiting the enzyme that will break down the drug, as seen in example 2 and 3, or by inhibiting a prodrug from turning into its active form until it gets to the target site, as seen in example 1, causing the mass effects on the target. And now, there is something known as supra-additive synergism, where instead of having summation or addition, like the normal we see before, where you have 2 plus 2 equals 4, you're having 2 plus 2 equals 20. Both drugs being combined now have a far more greater effect than each of them individually, as seen in the examples given there. Next up is antagonism, whereby the combined effect of 2 or more drugs is less than the individual effects they would have. And the mechanism of action of these antagonists can either be chemical interference or interference at the receptor level. For chemical interference, we have functional antagonism, whereby both drugs have opposite effects and as such cancel each other out. A good example is epinephrine and diazepam. Next is chemical antagonism, whereby one deactivates the other one or reduce population of the other one in the body system. A good example is chelators and metals. The next mechanism of action is by them affecting drug disposition or total level interference. Drug disposition, they alter the absorption, distribution, metabolism, and excretion of the drug. And drugs that can do that is ipecac or charcoal. For receptor antagonism, this drug, like atropine, block the receptor, preventing the agonist from binding to the receptor.